Hi, I'm Tegan. I'm a health advisor assistant at the Florey Clinic here in Reading, and I'm here to answer some of the most commonly asked questions about sexual health. Is using 2 condoms better than 1? No. With 2 condoms, you're more likely to get friction, which can tear the condom and be a higher risk of pregnancy or an STI. So we always say only using 1 condom, but also using a different form of contraception. So whether that's the coil, implant, pill, just something to double up so you know you're covering from pregnancy and from STIs. What is normal vaginal discharge? So, vaginal discharge is basically a mucus that the vagina produces to clean itself. So you don't need to be doing any douching or anything like that. The vagina cleans itself. It's wonderful. For a lot of people, discharge can be a little bit different, and often it changes throughout menstrual cycles as well. So some points we know around ovulation, it can be a little bit thinner. Other points it can be a little bit thicker. The main thing is not to really worry unless there's any signs of something wrong. So signs of something wrong can be a really strong or bad smell, changes in colour or thickness. So for instance, for thrush, we tend to see quite a thick, almost like cottage cheese discharge tends to be one of the key signs for thrush. But if you're having any issues or any itching or anything like that, go to a sexual health clinic or go to your GP. Is my partner taking their condom off during sex sexual assault? Yes. So that is also known as stealthing. In the UK, it counts as sexual assault as it's someone changing sex to sex that you haven't consented to. If you thought you were having sex with a condom, someone taking that off, you no longer consented to that type of sex. So yes, it does count as sexual assault. And if you do want support around that, you can always go to a sexual assault referral centre or SARC for support there. They also do forensic side. If you feel like you don't want to go there, it's always worth going to your local sexual health service just for testing and that kind of thing afterwards. Can I catch an STI from a public toilet? There's a really quick answer to this. No. Should move on. Can a cold sore be sexually transmitted? Yes, so cold sores are a form of the herpes virus. There are 2 types of herpes, HSV1 and HSV2. And both of those can cause cold sores, so around your mouth, or genital herpes. It just depends on where you had the contact with someone else who had the blisters. So if you have a cold sore and you're performing oral sex on someone else, you can pass that cold sore on to them. Herpes is one of the most common STIs, so 70% of people have some form of herpes by the time they're 25. In a lot of people, it's asymptomatic, so they just don't have any of the blisters, any of the symptoms. And so as part of the NHS, so any NHS sexual health clinic, we don't routinely test for herpes unless someone has symptoms. So we'll test if people have the blisters, but we don't routinely offer blood tests for herpes. Why do I have pain during sex? So this one can be a little bit complicated and really depends on you. For some people, pain during sex can be a symptom of an STI, so especially if you're having it with other symptoms like discharge or pain when passing urine, all of that kind of stuff can be real key signs of an STI. So we'd say always worth getting yourself checked. And a lot of people are asymptomatic as well, so won't know that they've got any symptoms when they have an STI. For other people, if you're having really regular pain during sex, or if it's lasting for a long time, or even pain just around your genitals without having sex, go see a GP and get it checked out, because it could be a sign of something else. Does the pill still work if I've thrown up? So this can depend on how long after you took the pill that you've thrown up. So if you took it within 2 hours, then the body won't have had time to absorb the pill and it won't be effective. If you're throwing up, make sure you take another pill as soon as you've stopped throwing up, and then just take the next day, just take your next pill as normal at the same time, just stay on the same routine. If it's been more than 2 hours, it should be fine, but if you are worried, just give a sexual health clinic or your GP a call. What is HIV and why do we test for it? So HIV stands for Human Immunodeficiency Virus, and it is a virus that affects people's immune system. When you have HIV and you're not in any treatment, it can really affect your immune system so that you can't fight off things that other people would be able to. So HIV, if left without treatment, can develop into what we call AIDS, so acquired immunodeficiency syndrome. And that's a collection of illnesses that we tend to only see if people's immune system is really low. So some people are more likely to get HIV, men who have sex with other men, people who are intravenous drug users, people from certain areas of the world. However, that doesn't mean that people who don't fit into those criteria can't get HIV. It's a lot more common now, especially within straight couples, than it used to be. So as routine, we always test for HIV. What is a sexual health check? So this can be a little bit different depending on if you've got symptoms or no symptoms. If you have no symptoms, routinely we check for HIV, syphilis, chlamydia and gonorrhea. The HIV and syphilis test is a blood sample, and the chlamydia and gonorrhea is either a urine sample or a swab that we ask you to do yourself. Our home testing kits also test for the exact same thing, but instead of a blood sample from your arm, it's a finger prick test. If you do have symptoms, we'll need to do additional tests as well, and this might also include a doctor or a nurse doing an examination. Everything done at a sexual health clinic is completely confidential, including all of your notes being separate to your main NHS record, and all of your results are only given to you. At our clinic, so the Flory Clinic in Reading, we give all of our results by text, but if you do want them done a different way, then always make sure to tell your clinician when you see them. These have been some of the most commonly asked questions about sexual health. For more information, visit the NHS website, or in our case, Safe Sex Berkshire, or your local sexual health clinic.